Well, that's actually a hard question because there's a lot of information to cover. But I think the main principles is just to remind folks that it all comes down to limited stage versus advanced stage patients. Different to other types of lymphomas, we here very much manage patients differently if they have less and limited disease one side of the diaphragm versus more extensive treatment, disease. And I think, quite frankly, the way in which we typically think about it is combined modality approach and combined modality therapy for early stage limited patients, and combination chemotherapy approaches for more advanced stage patients. Even within that, there's a lot of changes happening, but the idea with early stage patients is to give as little treatment as necessary, and the patients with more advanced stage is to really incorporate novel therapies into that space. So I think there have been a number of changes in how we manage those patients. The changes have really been predominantly in advanced stage patients. And in that area, the use of PD-1 blockade in frontline therapy along with AVD, the nivo-AVD combination, has shown really promising results in comparison to brentuximab vedotin AVD chemotherapy in a large randomized study that was recently presented. That really showed that nivo-AVD, if the data holds up, will likely become the standard approach, at least in the US, for Hodgkin lymphoma patients with advanced stage.